everyone. I'm Dr. Monique Adu, and today we are diving into the question, does your doctor do this? Many of us have been trained just early on in our medical journey with the vigor and insight to do all that we can to serve our people and communities. Many of us have taken what we call the Hippocratic Oath. Oftentimes you hear it quoted regarding first do no harm. Today we're going to actually look at a good sample of the Hippocratic Oath, and we're going to reflect upon a little something that I read today as I was homeschooling my children with regard to Hippocrates and how he saw we as physicians and doctors should operate in terms of the doctor and patient relationship. Let me share my screen. So Hippocrates lived around 470 BC to 399 BC. Hippocrates is known as the father of medicine. He was an innovator and advanced thinker of his time, addressing thoughts and ideas in a way that many others did not at that time. According to a textbook that I was reading today to my children in homeschool, Hippocrates also taught that a doctor should love people. As I go through these things, we're asking ourselves, does my doctor do this? He taught doctors should love people. He said that when a physician examines a patient, he should be well dressed. He should give the patient full attention. He should answer objections patiently. He should be calm in the presence of difficulties that arise and give his directions in a friendly, quiet manner. Do you find that you as a doctor or you as a patient are experiencing things such as this? Do you find that your doctor is patient? Does he show love? Does he address you and your needs appropriately, taking time to make sure that he addresses these things? Now, as a doctor, I'm also seeking and digging deep within, because these are the things that I must do and that we all should do. Now, none of us are perfect, so we do oftentimes fall short, but we should always aim to do the best we can. Oftentimes, under the pressures and time constraints, I know we may often find that we are spending less and less time with our patients in this one-on-one manner, but we still have to try and do the best we can or change our situations so that we can provide this type of patient-centered care and really the type of care that we need to heal people, not just handing out medications, but taking time to teach, because this is literally the definition of a doctor. He is a teacher and he is to teach his patients what they can do to restore health, not provide medications just because a problem arises, but seeking to find out what the root cause is and using nutrition and lifestyle medicine to make an impact and long-lasting change. Let's continue onward with digging a little deeper into the Hippocratic Oath. I'm going to read to you a few lines that really, really can have us thinking and comparing what we see in our medical field today. Let's really think upon these things. I will use those dietary regimens which will benefit my patients according to my greatest ability and judgment, and I will do no harm or injustice to them. I will not give a lethal drug to anyone if I am asked, nor will I advise such a plan. And similarly, I will not give a woman a pessary to cause an abortion. In purity and according to divine law will I carry out my life and my art. I will not use the knife even upon those suffering from stones, but I will leave this to those who are trained in this craft. Into whatever homes I go, I will enter them for the benefit of the sick, avoiding any voluntary act of impropriety or corruption, including the seduction of women or men, whether they are free men or slaves. Whatever I see or hear in the lives of my patients, whether in connection with my professional practice or not, which ought not to be spoken of outside, I will keep secret, as considering all such things to be private. So long as I maintain this oath faithfully and without corruption, may it be granted to me to partake of life fully and the practice of my art, gaining the respect of all men for all time. However, should I transgress this oath and violate it, may the opposite be my fate. Now, many of us have never even heard of this side of the Hippocratic oath that many of us are quoting when we are in our introductory medical school ceremonies, when we're just beginning, or when we have finished our studies, we have accomplished our medicinal training, all these things in our goals. We are often quoting the Hippocratic oath, not knowing all these other things that also go along with the first do no harm famous quote that most of us may have said. Now, there may be some subtleties and nuances, of course, that may not fit our time, but just learning from the words of this physician and scientist from so long ago and reflecting upon them, I think is such a great exercise for us today, whether we are the physician providing the care, whether we are the physician providing the care, or we are the patient receiving the care. Does your doctor do any of these things? Let's ask ourselves today, and if we are finding that there is much lack and we are not being restored to health, at least by teaching and direction and the seeking to understand the causes versus just prescription forms of treatment being given, and at least not receiving the coupling of these things, then we really need to reflect upon who we're seeing. We need to reflect upon how we're practicing medicine and see what we can do to get back to the foundational core of truly what medicine is and how patients should be treated. None of us are perfect, as I mentioned, but let's grow and learn to be so much better. I hope this was helpful for you, and I will see you again soon.